order to truly appreciate living, you have to become very close to death. My name is Barbara Moore. I've been living with COPD for a little over 10 years. COPD has affected my entire life. I only go out when I absolutely want to. If it's for my grandson, it's okay. I'm extremely lucky to have the support system that I have. My support network is my husband. He supports me. He does pretty much everything for me, and he does all the heavy lifting. Next is my daughter, who is a social worker. She taught me how to speak to doctors to get the best answers and the best results for your questions. I was diagnosed in 2015, and in 2016 I had a major exacerbation and a sudden cardiac arrest. I started to feel something like anxiety, like adrenaline running through me. And I could feel my heart, but that was nothing new because I had ignored that symptom a long time. I felt that, but I didn't really think too much of it until I really couldn't get a breath in. And this is the most uncomfortable feeling, because when I say you can't get a breath in, it's like somebody put something in your throat and nothing can get in there. I could feel my legs going. I could feel all of these symptoms that would be familiar to anybody who has COPD and has had these exacerbations, but the first time around you never know. You don't know what it is. When I got out of the hospital with my first one, I went back to work, and a week later I had another sudden cardiac arrest. So this was 2 and 6 months. That was the scariest part because we really didn't know if this was going to keep happening every 6 months.
The one big fear that comes out of everything that my mom is going through is the next time she goes in the hospital going to be the last time?
The last time that I had an exacerbation, I decided that I was going to remove some of the stress from my life. I was going to dedicate my life to myself and getting better by going to resp rehab, continuing with my puffers, and asking for help when I need it. I'm on oxygen 24/7, and this is to save my heart, not necessarily for my lungs, but when my lungs are not compromised, my heart works better. I would tell somebody to talk to their doctor frankly and tell them what's going on. If we don't tell and the doctor doesn't ask, then we have wasted the visit. I get out of bed in the morning knowing that there's people out there that need my help. I had started a blog in 2017 called Catch Your Breath 60. I've written 3 books for COPD. I also have a support group that I run through Lung Health Foundation. It feels fabulous to be able to help people who can't find help otherwise. Quality of life is important to me. My family is important to me. I'm grateful every single day that I get out of bed because I get to see my family, my grandson. Oh, Hunter's adorable. He is my pride and joy. He is the reason I live. Just knowing that he's coming makes my day.
A big thank you to Barbara for sharing that amazing journey with COPD. And Barbara talks a lot about how important it is to build a support network and how critical the friends, the family, the caregivers are in helping her live well with chronic obstructive pulmonary disorder. And so tonight's event, we'll be taking a closer look at COPD and improving patient support networks and the importance of these key words, shared decision-making between the healthcare professionals and those who live with this disorder every day. Good evening and welcome to the Lung Health Foundation's World COPD Day event. And thank you to AstraZeneca Canada for their continued support of this annual program presented by the Lung Health Foundation. My name is Avis Favreau. I'm a longtime health journalist, and I have covered stories on COPD, the treatment, and the patients who are so deeply affected. I'm very honored to host this evening, and we're joining you live from the offices of the Lung Health Foundation, turned into a studio here in Toronto, Canada. But before we begin, we're going to acknowledge that the Lung Health Foundation is located on the treaty lands and territory of the Mississaugas of the Credit First Nation, as well as the traditional territory of the Huron-Wendat and the Haudenosaunee peoples. It's also an important reminder that this is work on behalf of all Canadians, including Indigenous people who have been and continue to be negatively impacted by Canada's history. To this day, Indigenous people in Canada still face serious health disparities and much higher rates of lung illness and death. So while we continue to learn, the Lung Health Foundation is committed to doing its part in reducing these health disparities and enhancing the healthcare system to meet the needs of Indigenous communities. This event is critically important to help build a national discussion around better care and better support for those who are affected. So tonight, you'll hear directly from people who live with COPD, a caregiver, respiratory therapist, and the doctors who treat those who have the disease. We'll also be hosting a live panel discussion so that patients can speak directly with healthcare professionals to highlight the importance of having a say in their own care for the best possible outcome. But first, we'll get the program underway, and I'm pleased to introduce the President and CEO of the Lung Health Foundation, Jessica Buckley.
Thank you very much, Avis. And again, a warm welcome to everyone that's joining us this evening. The importance of tonight's gathering is to really continue to build a community of support for lung health across Canada. I'm honored to be here representing the Lung Health Foundation and working alongside so many people that are dedicated, people with lived experience with lung disease, our health advocates, volunteers, our very important healthcare professionals, the staff of the Lung Health Foundation, our donors without we could never do what we do, and the thousands of stakeholders from across the country. We work every day to make sure that fellow Canadians can breathe easier. The Lung Health Foundation works to improve lung health for Canadians, and we focus on 5 key areas. Those are, of course, COPD, which we're focused on this evening, lung cancer, asthma, infectious disease, and the flu, and we also work to help youth avoid smoking and vaping and the devastating effects that can have on lung health. We are committed to a world where everyone can breathe easier. Again, tonight's focus is about COPD, chronic obstructive pulmonary disease. As of October 2019, COPD was the 5th leading cause of death and the #1 cause of hospitalization in Canada. Yet no one talks about it. And as a result, it's been under-prioritized and underfunded. The Lung Health Foundation aims to help Canadians with COPD live their lives to the fullest and keep them out of the hospital. Even one moderate exacerbation of COPD can increase the risk of hospitalization by 21%. 2 million Canadians have COPD, and it's estimated that another 1 million people are undiagnosed with the disease. 1 in 5 patients with COPD have died within the first year of their first hospitalization, and the direct costs associated with this disease will climb to almost 4.5 billion by the year 2030. That's staggering. We are able to provide support for COPD patients through our lung line, which is staffed by our respiratory therapists, both on the telephone and through the website. We also have support groups and a virtual program called Fitness for Breath, which helps COPD patients. Lung disease is a very serious health concern for many Canadians. So again, I'd like to thank you for joining us tonight, and I do look forward to the rest of the evening.
Chronic obstructive pulmonary disease, or COPD, is a chronic disease that damages the lungs and makes it harder and harder to breathe, sometimes causing an exacerbation. But what is an exacerbation? When COPD symptoms intensify suddenly, it's called an exacerbation. Exacerbations can be mild, moderate, or severe in nature. Mild and moderate exacerbation symptoms include unusual shortness of breath, cough, increase in phlegm, which may be more yellow, green, or brown. mild and moderate exacerbations are serious and can lead to hospitalization. Severe exacerbation symptoms can make you feel as if your lungs are under attack and you are literally gasping for air. These more severe exacerbations typically occur in COPD patients who have an infection in their lungs or airways. The muscles around your airways may constrict significantly, cutting off your air supply, leading to blue lips or fingers, confusion, drowsiness, and extreme shortness of breath. If you are experiencing any of the symptoms of a severe exacerbation, call 911 right away. Whether you have a mild, moderate, or severe exacerbation, it is important to always report it to your healthcare provider. A COPD checklist can help you remember some important items to discuss with your healthcare provider, so you always feel confident sharing your symptoms. This will help them to provide the best treatment plan for you. Keep this checklist and your med list handy to review with your healthcare provider. This information can help them make decisions on how to improve the management of your COPD, take action to prevent further exacerbations, and help you live life to the fullest.
That checklist will be posted on the Lung Health Foundation website. In order for you to get the best treatment plan, keep the checklist handy so that you're confident in sharing your symptoms with your healthcare provider. Just as Barbara said, you have to ask and you have to fill in the blanks in order to get the best care. You have to fill in the information. And so now this is where we begin our panel discussion, and I'm going to tell you a little bit about our guests that we'll be speaking to tonight. They will give their insights and we'll have an open discussion about shared decision-making, treatment, and the difficulties of living with COPD. First is Chris Haromy, a registered respiratory therapist at the Lung Health Foundation. Chris has helped for the past 25 years develop and implement health programs for patients and healthcare professionals. Dr. Gerard Cox is here. He also has a special interest in interstitial lung diseases like pulmonary fibrosis. Erika Penz is an associate professor of respirology and critical care and sleep medicine at the University of Saskatchewan, where she also serves as director of the Respirology Fellowship Training Program and is the medical lead for the Saskatchewan Lung Cancer Screening Program. And with me here in our studio is Karen Urbshott, who's been living with COPD and emphysema with a component of asthma since 2012. And Karen believes everyone with lung disease has a unique story to share, and you'll be sharing that. And alongside her is Ken Hansen. He is one of Karen's caregivers, her ex-husband, and has been helping her since her diagnosis in 2012. Welcome everyone. I'm going to start with you, Karen. When you got the diagnosis, what was that like?
It was really scary and a little overwhelming. My dad had COPD as well, so I watched him with his journey.
Did you see him suffer?
I did. When my mom didn't know how to handle, she would call me. So watching him and knowing that I was following in his footsteps and that my kids would be watching as well.
It was hard.
It was hard.
And were you prepared, or when you started working with your healthcare team, were they able to give you the tools to deal with it? Or was it a bit of a struggle at the beginning?
It was a hard journey. It was a struggle. They don't always have the time to explain everything. You go in, they give you your inhalers, you have your lung function test, they tell you have COPD, and then they send you along your way. And so there's no time for questions, no education. You're just kind of left hanging. You don't really know which way to go next.
Mm-hmm. What do you wish they had offered you?
Resources. Somewhere to talk to somebody, somewhere to go, someone who has the experience that's living with COPD, that could tell me what the journey is going to be like, the things that I'm going to go through, you know, how to cope with the disease, what my family's going to go through.
So you felt lost?
Lost, totally lost.
Totally.
Yeah.
And so what point, Ken, did you come in and start helping, assisting? When did you feel you needed to help Karen?
I think it started about 4 years ago, after we had separated, and I just felt that she needed that help. She needed that support, which she wasn't getting. So she did a lot of research and informed me of all this, and I just became more and more helpful towards her, you know, doing things for her, being there, talking to her every night, going with the ups and downs. And there's quite a few of them.
Really?
Quite a few of them, yes.
It's
You
a
could be
roller
talking
coaster.
to her 1 minute where she's fine. 2 minutes later after a discussion, no. She,
So some
down.
people would say it's unusual that a formerly married couple would help each other, but do you get some fulfillment out of working together this
Yes.
way?
It's been a lot better.
I think we get a lot better now because he understands. I think what people have a hard time when they see us, we don't look sick. So he would see me as, well, I don't really see anything wrong with her. Why does she need help? But as he got to know more about the disease, then he could see why.
Now, what is one thing, Karen, that you would change in your care that you received since your COPD diagnosis? Is there anything you would change?
Yes, two things actually. I would join the Lung Health Foundation for their support groups and their exercise classes. I think that's really important, and to get hooked up with a pulmonary rehab. I went to St. Joe's Pulmonary Rehab, and
This is in London, Ontario, where you live.
Right.
Yeah.
And I met people with the same disease.
Is that important?
That's huge. It's huge. Finally, somebody that gets you.
How does that help?
They know your struggles. They know what you're going through. And one of the best things that I found is that, excuse me, they can share if they found an easier way for something. For example, winter coats are so heavy, and to carry around a winter coat. And one lady said to me, you know, Columbia sells a really light winter coat. That's great. Like, it's so much lighter, so much easier.
So don't try to do it alone.
Right.
Was Karen trying to do it alone at the beginning?
Which was probably my fault, because I was in that situation where you don't accept what's going on to start with, you know, and that was a lot of issues there. But yes, she was trying to do it alone. And then once I got involved with it too, I think it's helped her a lot.
So ask for help.
Yes.
What do you wish that more Canadians knew about COPD?
I wish they knew that just because we don't look sick doesn't mean we aren't, and that we're not faking it, because I'm not on oxygen. I move around like anybody walking in a store would have no idea. When I get out of my handicap parking spot, they don't know why I have a handicap parking spot. But if they watched me walk to the store and saw how short a breath I would get, then they would realize.
So you find you have to explain yourself to people?
Yeah, sometimes, yes. Yes.
And you have to say, I have COPD. Is there a stigma with it at all?
There's a huge stigma. Right away, as soon as you say you have COPD, they go, well, you smoked. You deserve it. But there's so many other things that can cause or contribute to. I was a hairdresser for 26 years around the chemicals. I was self-employed. I traveled to the seniors and disabled in their homes. No ventilation, overdoing perms and colors. My dad was a custodian around chemicals. So it all contributes to
it, right. So one of the themes of tonight is shared decision making. Do you feel you've been a part of the decision making in your therapy, or have you seen an evolution towards that direction?
I think it's getting better, but in the beginning, back when I was diagnosed, there wasn't the education or the resources. So I didn't really know enough of it to ask the right questions. I see now, looking back, how I could have asked more questions, and maybe we could have worked better as a team, but in the beginning, it wasn't a team.
Mm-hmm. Actually, let me ask Dr. Cox about that. The idea of just shared decision making, is that something that is becoming more prominent in this?
It is, but to share the decision making, you have to share the information, and you have to understand what's going on. And we're off to an unequal start with us on the healthcare side and our patients coming in. As we've heard now from two, that they were surprised at the diagnosis, overwhelmed at the diagnosis. For us, that happens every day at work, that we make the diagnosis. So to get to a position where we can have shared decision making, it's a journey. And you've heard already that it appears that we don't have time to take to explain everything. And that regrettably is true. And I think that's one of the things that we're hearing a little bit about, and I hope there'll be more about, is where can people get information? Where can they get it in a way that they can consume it, digest it, understand it, and use it? That's a huge important part of the equation here. And where the Lung Association, your predecessors, now the Lung Foundation, with its connections to the community and to healthcare providers, is at a lovely intersection to provide that sort of forum. So yes, it'll be a great place to be, Elvis, but we've a long way to get to the starting line for shared decision.
Right. Okay, one more question for you, Karen. If you had to offer a piece of advice to other people watching with COPD, what would that be?
To ask for help would be the main thing, but
you want to come? You can think about it. We can come back to that. But not do it alone.
Not do it alone.
Find support.
Find support. That's the biggest thing. Finding support. Joining a lung support group and joining a rehab group. They're the most important groups that you can have.
So, Ken, from your side in helping Karen, what have you seen are the difficulties for people with COPD in terms of getting resources and help?
Getting the right information out, finding, like Karen said, in 2012 when she was diagnosed, there really wasn't a lot coming out. And if we can get to the point where some of the other diseases now that are coming up and get more of this COPD out there, it's going to be a lot more helpful to other people, right? But, sorry, go ahead.
No. Well, I guess, what is it that you do to help her day to day? Like, what's your role?
I talk to her all the time. We talk every night. If she needs to go shopping or needs to go to her doctor's appointments, then I'll come into town, pick her up, and away we go and see her appointments, get back home, try and keep her positive all the time.
Emotional support.
Just be there as a good friend now, and we get along great. It's helped her a lot.
Right, and you find you can bring her up if she's feeling down?
I try my best.
Is he good at it?
He's good at it. He is good at the support part. But I must say too, though, I live with my one son, and he's the muscle around the house. He does everything that I'm not able to do. He gets the groceries. He puts up a tent for me in the winter so I can put my car inside. He does all the heavy lifting. He does everything that I'm not able to do anymore.
That's lovely.
Yeah.
So Ken, what would you say that people with COPD need to make their lives better?
Help, assistance,
Education.
more education,
Resources.
yeah, and finding somebody that can help them. I think we've come a long ways in the last 4 years. And if they can find someone like that to be with them and to go through this and help them with as little as they can, which means a lot, then I think that's would be a good thing for them.
Well, okay, so now I'll bring in Dr. Cox and Dr. Penz from Saskatchewan. So you've heard the couple here talking about how they need help, and I'm just wondering, as respirologists, what do you think, what would you wish in primary care that would be done to ensure that more Canadians are properly diagnosed and given the help to start off? Dr. Cox, you want to start?
Sure. I think in primary care, I think the role is to to listen, to see in the context of everything else the primary care provider knows about the patient, where this illness is coming from, to do something, if possible, to cut it off there, which is stopping smoking, treating infections, and then making an accurate diagnosis. And that's where we've heard about spirometry. And in the last 20 years, there's been a big push in our province to have spirometry available in primary care and to diagnose airflow obstruction. That's the second letter in COPD, obstruction. You can't diagnose that accurately without spirometry, and separating asthma from COPD, which Karen has, both of those, with some differences in how they're managed as a key second part too. So I think making an accurate diagnosis and taking care of the whole problem that the patient has, not just having some difficulty breathing today. What about you, Erika?
To sort of have my dreams met in primary care, I think one of them is, number one, recognizing primary care, our colleagues are under such enormous stress and time constraints. And so having access to supports at that level is so critical for helping our patients. Number one, around spirometry and, getting the tests that are needed to make a diagnosis. But to be honest, I think there's, so many other health professionals that can come in and really support primary care. So when you think about our certified respiratory educators, and respiratory therapists, the role that they can play in the beginning, where they have so much knowledge about the disease of COPD, they can really spend time with patients to explain it, to if they're starting new medications, to actually go through technique, talk to them about the importance of taking it, review their options, because we've got many options now, and then also assist them with sort of all of the other things that are going to help hopefully improve some of the quality of life around exercise, getting linked in programs, finding the resources for their support. So I think there's so much that we should do at the primary care level that could improve the journey for our patients with COPD. It just requires, recognition of these other experienced individuals and putting some resources to support them.
Right. Are you finding patients falling through the cracks because of COVID?
Oh gosh, yes, absolutely. I think Dr. Cox had, spoke to it a little bit earlier. Part of the terrible thing that happened early in the pandemic was, the fear around seeking care, and so many people, stayed behind. We were also, in Saskatchewan, I think many provinces across the country mandated to, not perform lung function testing, for example, because of its risk of spreading the virus, because it was a aerosol producing procedure. And so, that delayed testing for people who are at risk and having symptoms we could have made a diagnosis. So I think that, we're now playing catch up, because our system continues to be strained, as Dr. Cox again mentioned, with our influenza season and all of that. So there's lots of challenges that we still face, and people are unfortunately still falling through the cracks.
To either of you, is there anything or tips that you can give people with COPD so that they feel more empowered to speak with their doctors and healthcare providers? Are there key phrases or things that they should say?
Gosh, that's a great question. I'm not sure. Well, I'm not sure if there's key phrases that they could say, but I'm thinking about the resources that are now available for our patients. So these new checklists, for example, we've had checklists that patients can access from Living Well for COPD and through the Lung Health Foundation, and I think these checklists provide at least some of the key things that an individual can bring to their provider and say, this checklist says that I need to talk about an action plan. What is an action plan? I've never heard of that before. And that can actually open up the conversation. And I think it's a great thing because oftentimes as physicians, yes, we're rushed. We have our own agendas of what we want to try and address with our patients. But to be honest, we have to be able to actually hear what's the priority for our patient in front of us today. And having, patients at least having checklists or the opportunity to bring some of those issues forward can really help us do our jobs better.
Yeah, I could see Karen nodding when you said, what's the action plan? Because that becomes critical in deciding. I want to bring in Chris Haromy, who is a lung health staff member, who's also on Zoom. Hi, Chris. When you deal with patients who call the lung health line, and what is their biggest concern when you get the calls?
Well, it definitely varies. So it would depend on, for example, if they've just been diagnosed with COPD, they would have, potentially different questions. If they've had it for 10, 15 years, they still have, lots of questions. It would really depend on the individual. There's so many varieties of questions they would be initially asking about, but usually it leads into a longer term discussion about their COPD. And what it generally comes down to is really for the vast majority of callers and people who chat with us on our live chat and email us is, I've got COPD. It definitely limits my life to a certain extent. How can I improve the control of my COPD so that I can live life to the fullest that I can, do the things I need to do and do the things I like to do, like sports and activities. So that's really what it boils down to is, what are the steps I can take in order to get the best control of my COPD, whether it's learning how to use your inhalers properly, getting regular exercise, avoiding irritants.
And when
those
they
kind of
call
things.
in, do you have things that you can offer them to help them?
Well, we've got our lung health line, so that's available Monday to Friday, 8:30 to 4:30 at this point Eastern time, and that's staffed by respiratory therapists like myself and certified respiratory educators. So we do an initial assessment of what kind of initial questions they have, and can set up regular visits as well. Can be by video, by telephone, even by email if that's what they're interested in. Setting goals to try and educate them on the different self-management strategies like breathing techniques, the action plan you mentioned. We can link them up to our peer support group, which Karen highlighted the benefits of that. They're tremendous, sharing with people who have a similar circumstance as yourself.
Right. And that's what, I guess that brings us back to what you were saying. Ask for help. Get help because then you're not alone.
That's right.
Exactly.
So would that be the key message then for tonight?
Absolutely.
So I want to give a heartfelt thank you to all our panelists, Karen and Ken, and the physicians and Chris on Zoom. I want to thank you for all your thoughts and your insights. And the goal is clearly to create a future where shared decisions are at the forefront of treatment plans and management for healthcare providers and those who live with COPD. So for those of you watching online, please consider joining and signing up for the Lung Health Foundation newsletter, following the Lung Health Foundation on all the social media platforms, joining a Fitness for Breath class that's offered, or visiting the website to download the many resources and the checklist free of charge. And if you have any questions about COPD, please call the Lung Health line, where Chris will be one of the people answering, at 1-888-344-LUNG, L-U-N-G, or 5864. If you've enjoyed the evening and would like to support Lung Health, the Lung Health Foundation, please consider making a donation at lunghealth.ca/give. And thank you again to AstraZeneca for your generous support of the annual World COPD Day. Have a pleasant and safe evening, and thank you for joining us.